We'll go ahead and we'll introduce Dr. Omole. So go to the next slide, please.
You can
So we're
skip
going to be
introducing
doing
me,
some.
Sean, but
No, you don't want to be introduced? Really?
not
Do you want to?
really.
Okay,
Like,
she
is
does
this?
not want to be introduced.
No, I'm a general surgeon and breast surgical oncologist in Scarborough. I'm the president of BPAO. Went to U of T, and I've gone to I've done like 3 fellowships. I'm old. And I've written like so many CVs, basically because I've applied for so many jobs. So here we are. So I'm going to be talking to you guys about how to craft a professional CV. Juliana mentioned before that, part of, the CV, like they don't really tell you what, like how to structure it. So I'm going through more of like the key points that should be in it. Remember that you have to tell a story, and where the CV is what helps you land the part. So you have to make sure that you stand out in a sea of other people who, to be honest, like we are in the top 2% of the population. There's probably very little difference between each of us in terms of. Although when I look at Juliana saying she had a spreadsheet for things, I'm like, oh, she's way above me. So I would say though, but what sets you apart is how you tell your story, and that's part of your CV, and that's your personal statement. So next slide, please. So no, go back. So there we go. Make sure that you're connecting the dots for the reviewers. So as they're scanning, Juliana said they only read the first 4 or 5 pages. That is probably a little generous in terms of how much they read. So just make sure that your CV clearly aligns with the program and the specialty that you're applying to. And if you're applying to more than one specialty, you might have different versions of your CV because certain skill sets are more valued. For example, emergency medicine. If you're trying to demonstrate the fact that you're a person who's quite adaptable and is quick on your feet, then you can word the same experience to show that, versus if you're in internal medicine where it's supposed to be more, this is my bias, slow, methodical, and thinking about things for hours before making a decision. So making sure that as you're like what is required, that you're crafting each element of your CV to reflect some of those skill sets. And you also want to make sure that you're putting up front some of the specialized skills and experience sets so that benefit you from each program. And so making sure that you are listing that. I think before you start your CV is to make sure that you sit down and you write out, what each program slash specialty is looking for. And once you do that, then say, okay, I've done this, what did I learn from this, or what have I done in this that demonstrates this skill set. Next slide. So for a good resume is that you just list your qualifications. However, what's better is to tailor the qualifications to the program that you're applying for. Make sure that you have a good, creative, reader-friendly format versus a standard one that just kind of lists everything. Instead of just saying, I'm going to use Juliana, I was the chair of the BMSAC, you can say, as the chair of the BMSAC, we're able to start the first annual, I don't know what you did, Juliana. We were able to start the first annual conference. We're able to develop the BMSAC scorecard for each universities across Canada. So using those type of language is much more it's easier to read, and people are like, oh wow, like she did this, they did this. This is really impressive. Make sure you emphasize specific skills that's needed. If you're applying to a surgical program, you do need to have some hands, like some eye-hand coordination, and have the ability to be good with your hands. So demonstrating that in different things and innovation, all of those things are important. Making sure that you don't have you don't want to have a basic like, okay, this is the CV I'm going to send for everything. You want to be able to apply to different things. And so making sure that you word things, that this does take time to craft, to word it to different specialties that you are applying for. Instead of just focusing on, I did this or I was in charge of this, show what the impact is. So I'll use myself as an example. I am the president of the Black Physicians of Ontario. And I say, as the president of the Black Physicians of Ontario, we've been able to start increasing our CPDs from um, one yearly to 4 every year. We've engaged more than over, I'm making all this up at this point, we've engaged more than over 400 new members. So making sure you're doing quantifiable things and not just saying, I'm the president of BPAO, saying, as the president of BPAO, this is what we've been doing. This is what I've been doing. Next slide, please. Make sure that it is relevant to what you're doing. If you've done something that has been outstanding in high school or in undergrad, then obviously include it. But if it hasn't been, like if you were a babysitter, like that doesn't necessarily is relevant to the program you're applying to. So don't include something like that. Make sure that it's clear, you can locate the information, and like as you're reading it, that it's not too wordy and it's very concise. And make sure that you're highlighting things about you that go above what is expected, that people will be like, wow, this is what this person has done. I think it's important as you're doing this is to always keep in mind the CanMed flower. I'm going to show it when we talk about personal statement, but using the CanMed guidelines is actually really important because all programs are looking for that. So making sure that in each of the things that you were describing that you've done, you've hit at least, if not all, most of those CanMeds. Like the collaborator, it's like, it's iffy, but like, you're showing that you're a medical expert, which is research, right? You're showing that, you are advocacy, things like Juliana said, like, chair of this or, initiatives that you've done. So making sure that you're using that as a bit of a guideline to make sure you're highlighting those aspects in your CV of what you've done. Next slide, please. So use the CAR method. So always start off with, what if there was a challenge and then you were able to have an action and then showing the results. So, members had wanted more CPD. So we've gone from, by instituting X, Y, and Z, we've been able to have 4 CPDs since my time as BPAO president. So that is kind of using the CAR method. Next slide, please. And I can make all of these slides available for you. And so make sure that your bullets are structured to be relevant and clear and impactful. So, for example, one would be as a medical expert. So this is what the CanMed tells you what a medical expert is. So as I said, so I'm pretending to be Juliana. This is what I was doing last night. As the chair of the BMSA initiative, I led 4 products involving stakeholder-driven guidelines for lung cancer screening. So that is very clear, and it shows exactly what you've done, and it shows you're medical experts because you're doing guidelines, and you can definitely make this longer, like a next bullet, this involved, XYZ community. We had over 300 participants and increased lung cancer screening by 50%. So that's how you want to do, let's say this is what you were doing as the chair of a BMSA initiative for lung cancer screening. So another requirement that, we talk about with CanMeds is a communicator. So, so what is like written down, if you check the Royal College, is what a communicator is. Physicians forming relationships with patients and their families to gather information and to disseminate information for effective healthcare. So, for example, this is what I designed and developed a comprehensive app-based physician-to-patient knowledge translation tool for kidney failure patients. This project, Jola Does Kidney Care, received the Great Institute for Overachieving Medical Learners Award of 2023. So making sure that so there's spelling mistakes because, as I said, I did this at 1 a.m. yesterday. So making sure that you have tangible outputs, but this also shows not just that you're a communicator, but you're also a medical expert. So there are many things that people think, oh, this, I only did this, but there's many ways to rework and retool what you've done to make it stronger. Next slide, please. So, so these are the questions that you can look at to making sure that the quality of your CV is tailored. Have you mirrored the program language and met all of the requirements? Does it align with the objectives and goals of the program I'm applying to? Are my sentence clear and straightforward? Is this accessible for people, that's like kind of like not very jargony? People love to use acronyms, but I think also when you're doing a CV, it's better to just spell things out. Always use the active voice, not the passive voice, and not overuse certain phrases. I would be very honest and say that, and you guys can just read through all the other aspects of it, and making sure that you're saying your qualifications and what makes you stand out for this program, I think, and being quantifiable in terms of the achievements that you've done. And I would say that I'm very strongly against using Chat GPT to create your CV. What you can do is you can write something out, write it as well as you want, then plug it into Chat GPT and see what it spits back at you. Maybe it'll make it a little more clear, but it really shouldn't be something generically created, because then we can tell that it's something generically created. Next slide. So this is the guide that Juliana had shared with me that she used in terms of creating her CV. And I looked at Juliana's CV, which we'll look at in a minute, and it's really nice. It's really clear and concise. And the points that I'd given earlier is just how to make things a little bit sharper. Mary, do you mind just dropping it into the chat, the link to this? I think you have Saskatchewan CV guide. Can you scroll up and down also? Sorry, I'm asking you for many things. Yeah, and so it's kind of hard to see because honestly, I can't read that right now. But it kind of goes through, putting in each section of what you've done in terms of your activities. Making sure that I think it's always tricky when you're applying to two specialties, like how much you should put of what you've done in the other one. It's always helpful when you're trying to do specialties that are a little bit related, because then it would make sense that you did this other rotation. And obviously, if you're applying to family, the more diverse you have, the better it is. Next slide, please. Okay. So this is Juliana's CV. Can you make this bigger? Juliana, do you want to walk through your CV?
I'll share the CV itself.
Mm-hmm. Fumi, are you still here?
Oh, yes, I am. Just a second.
Okay.
I'm here.
Okay. Mary, are you just sharing her CV? Okay. So this is Juliana's CV, and Juliana, just chat, jump in when you want to. So going through her clinical experiences, so you can see everything that she has been doing, that she did. Obviously, her education, always doing it from your most recent to your least recent, and her clinical experiences. Then going through awards and distinctions. And then doing the research is where you can do when you do the bullet points. So she was leading the study as chair and past chair of the Black BMSA. So it's in the active voice of I am leading a study. She spearheaded 3 abstract submissions for X, Y, and Z. Keep on going, scrolling, please. So slow down. I'm just picking out like things that she's done. There's the CASPER program. So led as director of the CASPER program, implementing curricula for Chem Med roles and impact and participants. I would even put a little bit of maybe like what the outcome was, just to make it a little bit stronger. I'm not sure where CASPER is, but you can tell me, Juliana, if that was possible to do.
I guess, yes, I could have. I just mentioned the impact we had on students. which was a lot. So yes.
Okay. And then I'm reading something about the dose response of beans.
Yes, that is correct. I did a bit of nutrition research.
Like ewa.
Yes, yes, Ewa.
Okay, interesting. So actively engaged in recruiting, I would just say, in charge of or directed recruitment and onboarding of 10 participants in this randomized crossover clinical trial. So those are type of the things that you can be doing to make it strong, like to give it an active voice. And then abstracts and publications. As you can see, she is very busy. And then presentations that she's done. Medical and patient education, that is a really, and so as you can see through this, just stop for a second, you can see through this is really picking up on some of the the CAN-Med roles, and I can pick out the ones that she's done. Chair of Education Committee for BMSAC, established a committee, facilitated review process, having very concrete things, and as I said, developing the official cards to highlight areas of improvement. So, those type of things are really important in terms of highlighting the things that you've done. And then leadership and advocacy, community engagement, and then previous employment. So, having like these things are all parts of work that actually feed into medicine. So being a tutor is important because that shows that you're an expert at something. Helping students who have disabilities, that shows that like there's a level of like empathy in there, collaborator, community engagement, and all of those things are important employments to have in there. And then the rest is just like your hobbies and your professional memberships, all those things. All right, we can stop sharing this. Juliana, do you have anything to add?
In terms of, I guess, your awards and especially with respect, I'll start with the awards. And so I tried to shorten things to make it fit into 5 pages. There are some schools that I actually ended up having 6 pages for. So schools that didn't specify limited to 5 pages, I actually just ended up having it 6 pages and added a few more awards. But I listed some of the most important awards up front. With your research experiences, if you have many more research experiences, I would only list the ones that are the most important in terms of you were able to have the most impact. You learned the most from those ones. And if you want to list more, you can shorten things as well. And even with your publications, what I've seen some people do is if they have a more comprehensive list, for example, ResearchGate, they would list like the first few and then include a link to their ResearchGate publication. So that's if you have like many publications and would just take up space unnecessarily on your CV. So that's something else you can do as well. But otherwise, yeah.
And I think you should prioritize, ones where you've been like if you've published to that, or you've done a poster, or you've done. You guys don't do ground rounds, but like if you've done any presentation or any sort of public speaking regarding what you've done, list those before others where it's you're like it hasn't published and maybe you were just doing a little bit less involved in it. So the ones that you have the most impact and also the ones that are the most relevant to the program that you're applying to. Next slide, please. Excuse me. Okay, so I guess we can just do some questions. Does anyone have any questions regarding the CV?
There's one question here in the chat that's just quite specific. So would involvement in an international program in high school be helpful, or a medal from air cadets, or is it getting too far from current?
I don't know the answer to that. I think that like I'm assuming that's like a big deal. So then if it's a big deal, put it.
That was it from the questions that were in the chat and in the Q&A. So if nobody has any other
Oh,
questions,
so there's
then we
one
can.
more.
Oh,
Would
yeah,
you
go ahead.
include mini presentations, talks, and career paths for high school students? I actually would, and I would structure it very differently. Like if you created something, or you were the one who put things together, just I would put it. I wouldn't even say it as like a mini presentation. Just I would put it as under like volunteer work experience, but I also probably would put it under presentations if you'd have space for it.
Thank you. So we'll round out our day by the last session, which is also going to be led by Dr. Amole. So she can go ahead.
Okay, so storytelling. Those who tell the best stories rule the world. As I always say, history is told by the winners. And so it's really important that you understand that your personal statement is to tell a story about yourself. Next slide. So the first thing is, please read the program prompts and answer the questions that they ask you. So, don't go off on a tangent and say, well, I just want to write this. Make sure that if a program asks questions, answer the questions. You can still use the questions to answer questions about yourself, to highlight those aspects of yourself that are strong, but you still need to be able to answer the question. Especially if you're applying to multiple programs, make sure you're paying attention and you're reading to make sure that the length is in line with the programs and that your content is addressing the questions that they're asking you. They want to know that you have a genuine interest in being in this program. So make sure that you have evidence that shows why you are motivated. I mean, people always say, well, why do we do research? Well, first, the basis of medicine is research. And the second part is that it shows that you're excited and that you want to know more. You want to be more engaged in this work. So make sure that that comes out, because especially if you're like a 5-year program, I want to train someone who enjoys coming here, not every single day, but who has at least an interest in being here. So you have to find a way to tell that story, that you're someone who's excited to be an emergency physician, you're excited to be a family doctor, and why you're excited to do that, and what skills and what assets you bring into the program. Next slide, please. If you have any discrepancies, especially programs who are looking at your undergrad grades, make sure that you find a way to address that within your personal statement. Make sure you're always using the active voice. So you put I in the subject instead of saying allowing or gave. So you're not the receiver, but you're the one who is doing something. Implemented. I did this. I led this. I was in charge of XYZ. I would say that, majority of us, like Shambe and me, we're all immigrants. And so putting that, as an immigrant growing up, to be honest, that's just it could be a waste of 50 words, unless it's as an immigrant growing up, in a refugee camp, and I saw XYZ, and this is why I want to become a trauma surgeon. That's very different. So making sure that those backstories are not needed at this stage. What's more needed is, what is your commitment to wanting to become X, Y, and Z, and why do you want to come to this program, and answering the questions that they ask you. Next slide, please. So be explicit. You want to make it clear that there is nothing I would rather do than become an internal medicine physician in Saskatchewan. You have to make it clear, and why Saskatchewan? Why do I want to come to Saskatchewan? Oftentimes, it's honestly just reading a little bit about, for example, I know Manitoba, University of Manitoba, for example, does a lot of research in Indigenous health in terms of internal medicine. So maybe that's something that you're really passionate about. That's something you're really interested in. So finding little nuggets about each place you're applying to is really important, of, demonstrating why you want to come there. And make sure you say what you want to be at the end of it. I love emergency medicine, and I want to, excuse me, I want to do rural emergency medicine at the end of my, 5 years. Most people don't do that. Most people do academic, but making it clear that you've thought a little bit more of, although I have not explored all specialties, of subspecialties in general surgery, I have an interest in breast oncology and surgical oncology, given my experience working with X, Y, and Z. So you can put that thing in. So it shows that, okay, well, this person's actually thought through why they want to be here. Next slide. And honestly, make sure that you revise it, you revise it, you revise it. You should take time to write it. Start writing it. You might want to start off with just, going through, maybe this is where the spreadsheet comes in handy, going through each school to see do they have questions? Do they not have questions? And then thinking about, okay, if I want to be an emergency physician, what are the skill sets that they're thinking about? Well, they probably want someone who's a leader. They want someone who is inquisitive. They want someone who is a great communicator. And then just kind of listing the things that you think are important for that program, or you've heard about that program as you've gone through your electives and your rotation in it. And then say, okay, what have I done to demonstrate this? What have I done to demonstrate this? And then you start to write your paper, your personal statement. And I think that is the end.
Thank you.
Questions?
So there's a question, in the Q&A for you. It's a bit related to the CV, but if you've received funding from notable organizations for an initiative you're leading, would you include that in awards or the honor section or somewhere else?
So I think it depends on what you did, what the funding was for. So let's say I received $10,000 grant from BPAO to conduct a study on lung cancer screening in Black and racialized populations. I would put that under work, but then I would also put that under honors and awards.
Perfect, thank you. And I'm just going to add to your last point, revise, revise, revise. Also, don't underestimate the power of having different people from different areas in your life read over your CV, because sometimes we might use different jargons. Like we talked about the acronyms, and it's nice to just have a range of people review it before you submit. So we will move on to the next slide. So we're literally just kind of winding down, guys. We're at time. So we'd like to thank everybody for attending today's seminar, which we did talk about will be recorded and made available for sharing. We want to thank each and every one of our panel members, our speakers today, who put together their thoughts to help everybody move forwards in CARMs. We just want to mention to please stay tuned to everything BPAO does, because we'll have much more coming live on webinars. We have different in-person events for learners, medical students, residents. So please stay tuned and join BPAO, because right now your membership is free and you'll have access to a lot of the things that I just mentioned. So we'll be more than happy to have everyone on this call as a new member. And again, thank you, everybody. And look out for our events and look out for some follow-up emails from this particular session. Everyone have a good night.
Thanks so much. Bye. And thank you so much to Mary for organizing everything.
Thank you to Mary.